we're thinking about 3 to kind of service provision and informal support that people may draw on, or looking at the barriers to accessing that type of support. 3 to the kind of, the traditional development or evaluation of defined interventions and programs. And just to say, we're looking for projects across all settings. And we'd be I was talking to Louise yesterday, we'd be so delighted to receive projects with a focus on educational settings or social care settings. And of course, we won't be able to privilege them, but we just kind of we would like to encourage diversity in terms of the settings that you're thinking about. There's a broad range of targets for interventions or projects. So they could be families, professionals, communities, systems. And we also are keen to think, to encourage you to think about meta research, so research about research. So one of the things that I sometimes observe is that particularly, the evidence base around children, it can be patchy. And the evidence in the UK particularly isn't accumulating very fast, and I'm always interested to think about the reasons for that. So research around research with an intervention focus would also be encouraged. So, and I will turn, I'm looking at my notes, so I'll turn to the comments in a minute if anyone's written anything. But the type of projects we might be looking for are development of novel interventions, although I'd encourage you to think about, is there really a gap there, and is there anything else that you could think of first to adapt? So if you're thinking about development of a novel intervention, there needs to be a good reason why you're looking to do that, rather than adapt something that's already existing. You might be thinking about small kind of pilot studies of interventions. You might be thinking about secondary analysis, either for cohort data or other types of data that have already been collected. You might be thinking about systematic reviews to draw together the kind of state of the evidence around particular groups who may be looking to access support and interventions, or particular types of interventions. So just give you a flavour of some of the questions that I thought about. So which groups, and they may overlap with some of the understanding stuff. So that's it will be good to kind of revisit your ideas for intervention research and just look at whether actually it may have been covered through the understanding stream of work. But which groups are underserved by current systems of support, and what should the response look like for these groups? What is the impact of violence and abuse as an effect modifier on access to and effectiveness of mental health interventions? So if domestic abuse is happening, do people get equal access to services, and then the services they get, do they work equally as well? How can frontline practitioners be better supported to support people who are experiencing domestic violence and abuse? So there's some of the kind of things that we would be thinking about encompassing as part of the small grants competition. But I'd be really keen, we also need to have this programme of events, and I'd be so keen to think about things that you would like to kind of see in the next year. So I've got one, okay, 100% very important work, suggestions, re-speakers at events, also welcome with respect to topic of interventions. So Louise is saying, we'd love to hear suggestions about speakers, but also kind of specific interventions that we might be focusing on. From Justin Coleman, will the network link in directly across the what work centres, interventions, etc. are being interventions are being populated but may not be overtly focused on violence and abuse? That's really interesting, because, thank you Justin, I've had a couple of conversations both with the Early Intervention Foundation and the Social Care Work Centre, and we'd be looking to really draw them in, but also there may be some programs of work around abuse that may be coming online, so we'd be looking looking to kind of draw that in and strengthen the links. But is there anything in terms of speakers or particular types of intervention that you think there should be a spotlight on in this next year? Technology-based interventions, I so agree, Zoe. it's the primary mode of our service. Oh, hold on, it's hard to read them when the questions are coming in. It's the primary mode of our service provision at Chain, and we've implemented a novel program of remote tech-based support since March and the onset of COVID. So I'd love to hear about what others have been doing. And I think actually we've got Leonie in our network, who is a kind of a tech-based expert, and I think that would be really great. I know that people are grappling, particularly with the conversion of face-to-face interventions into online options. It would be great to hear from Claire from survivor-led services and interventions to think about how researchers can provide support. The small local peer support survivor-led projects can often fall beneath the radar, even though they offer so much support. And I think that's brilliant. I think and we have already started conversations, and Sian and Louise have been having these conversations for some time about how we can think about strengthening links with the third sector. It's certainly my experience that if the third sector didn't exist, I wouldn't be able to do any research, and so and nor would many others. And they're absolutely, you know, they lead the response, but they're integral to you know, developing knowledge about what works. And so I think that's something that we could really think about. If anyone's got any, it's Zoe's finished on wonderful. Decolonising our sectors. That would be great, and that's certainly, there's a lot of activity within academic institutions around this, so that would be a great thing to think about. Okay, Sian is moving us on, and yeah, thank you. I look forward to kind of interacting with you all over the next year.